Before entering the patient's room, I would check the EMR for see if there's any new lab values and check new orders. I would also check the door to see if there's any isolation or fall risks. And then upon entering the room, I wash hands and I introduce myself. My name is Kylie. I will be your nurse today. Can you please tell me your name and date of birth?
Holly Dietrich, 12/21/70.
All right. And what brings you in today?
I've been having stomach pain.
Okay. Is there anything that helps the pain?
Just moving around, kind of sitting.
Sitting helps?
Yep.
Okay. Moving around makes it worse. Does it radiate anywhere? No. Okay. Is it more of a stabbing, dull, aching pain?
Kind of stabbing.
Okay. What would you rate your pain on a scale from 0 to 10 today?
I can get up to a 6.
Okay. And when did this first start?
2 weeks ago.
Okay, sounds good. And as you can see, the patient is relaxed, she's comfortable, her head is midline, her head is erect, she does have level consciousness. Could you please tell me what time it is?
9 o'clock.
Okay. And do you know where you are?
In the clinic.
Okay. Patient is alert ×3. Her speech is articulate. She can pronounce words. Her personal hygiene, she seems clean and there's no odor to her. Her hearing, she responds to questions, and that's about it. We'll move on to her vitals. So first we'll get your temperature. Mouth. 97.7. Now we will check at the apical pulse and listen for a full minute. That's the 5th intercostal space. Okay, 58. We're also just going to listen to you breathe, or watch your respirations for 30 seconds and then multiply that times 2. Okay. All right, your respirations are 16. Oxygen level. At 94. And now we will move on to blood pressure. Now with your pain, are you able to tolerate what your pain level has been at, or you need stuff for it?
No, I can tolerate it.
Okay. So first we're going to feel for the brachial pulse and then pump up the blood pressure cuff to 20 more until you get 20 to 30 more after you can't stop feeling it when you listen for it. 102/60. Are you always low? Yeah. Okay. Then, as you can see, she responds to questions. Her eyes move spontaneously. She has been moving around. Her motor skills are good. I'll just test the strength now. Let's use my fingers. Okay. Then shrug your shoulders. And then push up on your hands. And then pull down. And then kick your legs out, one at a time. Alright. And then she has no ptosis or facial droop or any trouble swallowing. And then I will check her pupils. Her pupil size is 4 millimeters, and let's look at it. They both contract consensually. Okay. And now we'll move to respiratory. So we'll just listen to 6 spots anteriorly and then 6 to 8 spots posteriorly, and just listen for any adventitious sounds. Deep breaths in. Let's do your back now. Then I'll also get the lower lobes of the lungs. And then if she was having any coughing, you would want to ask about having any sputum or coughing anything up, and then also educate on taking deep breaths and using the incentive spirometer to increase the lung capacity. And now we will assess for the heart. We'll listen to the 5 points, the aortic, pulmonic, Erb's point, tricuspid, and mitral. And first we'll listen with the diaphragm, and then we'll move to the bell and see if there is any murmurs or gallops. And she did not have any adventitious sounds in her lungs. And S1 is best heard at the apex, and then S2 is best heard at the base of the heart. So there were no murmurs or gallops, and then you also want to, along with cardiovascular, check for capillary refill. So I'll just clean your fingernails. And you just want to make sure that the color comes back right away. Now check your toes. Okay, rolling down here, I'll just check your pulse. 2+ there. 2+ there. And there's no edema on your leg. Check this one. Capillary refill time is good. Pedal pulse is 2+. Tibialis pulse is also 2+. And there are no signs of edema. Okay. And then if they had an IV, you'd also want to check that side to see if there's any irritation. You'd want to check the fluid rate as well, just to make sure that is correct. And then when I was also checking her pulses, I checked the skin temperature, and her legs were warm bilaterally, and same with her arms. And then I also want to check the skin turgor, and it recoils right away. And you can also check on the clavicle, and that also recoils. Then I would also use a Braden scale to test for any skin breakdown if necessary. And then if she was in a specialized bed, I would check the settings on that to make sure that they were used properly. And then we will move on to her listening to her abdomen. So if you want to lay back. Alright. And her contour is flat. And then I will move on to assessing her sounds. Her sounds are present in all 4 quadrants. And then next we can palpate to see if there's any distension, firmness, tenderness, or even masses. First we'll start off with light and then move to deep palpation, so we know if it hurts. A little harder now. Do you go to the bathroom frequently? Do you have stools frequently?
Daily or every couple days.
Every couple days. And what's the color of your stool?
Brown.
And is it hard, mushy, kind of in between?
Yeah, kind of.
In between, depends on. And can you tolerate your diet, or does your diet need to be changed at all? No? Okay. Have you had any nausea?
No.
Okay. And then if she had any tubes, I would check for drainage and any irritation at that site. And then I would also ask, have you had any problems urinating? Do you urinate frequently?
Yes.
And what's the color of your urine?
I'm iron, so it's gold.
A little gold. Okay. And do you go a lot? Normal amount?
Yeah.
Okay. And do you have any pain urinating? No. Okay. And then since she is up self, she's not bed rest, so I wouldn't have to check the railings or anything like that. But I would want to check if she has any SCDs, TED hose, compression, because they would need to be worn. And I would also assess the standardized scale for a fall risk. And that would be all. Do you have any questions?
No.
Okay. Then I would want to check all the safety measures, make sure the bed is in lowest position, rails are up, call light, bed is locked. She has a side table, and then thank you for your time, and then I would wash my hands and be done.